A patient of mine who came in with nerve pain. So what does that mean? He's got numbness over here in these four fingers, the left hand worse than the right hand. And then the right hand has some like sensory problems like tingling, but it's definitely a lot weaker. And in looking at him, we can see that there's what's called atrophy. So what that means is just like the muscles are kind of sunken in. My name is Huang. I'm an occupational therapist and certified hand therapist. My therapy clinic is here in Miami, Florida. I think there's a lot of generalized information out there about what you can do. If you have carpal tunnel, then wear this brace, go get an injection, have surgery. However, even though it appears easy to hand surgeons, hand therapists, anyone that works in that space, they see it all the time. But you as the person who's experiencing it, it's really scary. You're starting to lose sensation in your hands, you don't understand why. You're starting to lose strength in your hand, you don't know why. My patient actually went to the surgeon, got all the nerve conduction tests, and the surgeon's telling him, like, it's really severe, you need to have surgery with therapy help. And here's how someone could potentially use therapy. If you're scared about the surgery, you're not really sure about what to do, going to therapy or getting really the right kind of therapy can help you determine, like, do I really need to do the surgery or not? Now, this patient, just based on the scenario and based on all the details I was getting, it actually has a neck component going on. There's some neck issues that are happening. But the hand surgeon, who actually work well with a lot, she was like, well, we just check and do surgery to the wrist, like where he has carpal tunnel. But looking at his hand, we know one hand has carpal tunnel and one hand has a cubital tunnel. So they're a little bit different, both hands. But the nerve conduction study tests show it's severe on both sides for carpal tunnel. Now, one of the things that I do with my patients is I go over there, they're reporting, and I talk to them. Sometimes therapy isn't about always avoiding the surgery, but helping someone become more confident, more comfortable with the fact that they may need this surgery. So one of his questions is like, the doctor is telling me that if I don't take care of it, it can be worse. Like, is that true? And I'm like, yes, it is true. If you have a problem, something is strangling that nerve in this area, you don't take care of it, one of the things that we're going to see is that you're gonna get weakness. But we're looking for very particular weaknesses in the hand. He doesn't have that yet. The other thing that can happen is that your sensation can become worse and then it can become permanent. So we don't want that to happen. So sometimes therapy is about avoiding surgery. I talk to a lot of people who are looking to avoid injections, looking to avoid surgery, and that's because a lot of times they're not candidates for these types of things. It was really important to understand when you have to go and get surgery, when you can avoid it. So finding a trusted therapist that can go through that process with you, it's really important so that you can, even if you decide to go and have surgery for something, you feel like you're really confident and comfortable that you've done everything you can, that you also know what to do after the surgery. Not everyone needs therapy after surgery, but it's always important to like have a little follow-up just in case, because with any surgery, I don't care how short the surgery is, how small the incisions are, there's always a risk and complications.